Good morning, ma'am, and all my batchmates. Now I'll do a demonstration on catheterization of urinary bladder. First, we'll see the definition of catheterization. Catheterization is the introduction of a catheter through the urethra into the bladder to remove urine. We'll see the purpose. The purpose is number 1, to remove acute or chronic urinary retention. Number 2 is to prevent bedwetting when the patient is incontinent. Number 3 is to provide for intermittent or continuous bladder drainage and irrigation. Number 4 is to obtain a sterile urine specimen. Number 5 is to maintain a urinary drainage when it is not desired for the patient to void, for example, after the repair of the perineum. Number 5 is to ensure the safety to emptying the bladder before operation of the pelvic organ. Now we will see the indication of catheterization. The first indication is in acute retention of urine in male patient with prostatic enlargement because of the hypertrophied prostate gland obstruct the urethra, leading to retention of urine. Number 2 is the chronic retention of urine due to which the patient will have a distended bladder with overflow of incontinence. Then number 3 indication is for comatose patient, neurogenic bladder, hypertonic bladder, spinal cord injury because of the lack of stimulation inhibit reflex relaxation of the internal urethral sphincter, resulting in retention of urine. Number 4 indication is incontinence of urine. Number 5 is before the surgical intervention of pelvic organ. Number 6 indication is in acute retention of urine for immediate relief. Number 7 is for investigative purpose in order to obtain a sterile specimen to instill medication or to assess the residual urine after voiding. Now we will see the preliminary assessment. What we have to do, we have to assess the patient before the procedure. Number 1 is we have to ascertain the patient fluids intake and urinary output in the previous 12 hours. Then we have to palpate the bladder to assess the level of distension. Then we have to identify the purpose of catheterization, and we have to check the patient's level of consciousness and ability to follow instruction. Required for catheterization. Number 1 is we have a screen with extra sheet or bath blanket, leggings or stocking to provide privacy and comfort to the patient. Then we need a Macintosh and a towel to prevent soiling of the bed linen. Then a bedpan and a perineal care tray, a wash down tray with soapy swabs, plain water swabs to wash the vulva thoroughly before catheterization. Then we need a kidney tray and a pep bag to discard the waste, a specimen bottle and a form to send the specimen, a pair of gloves to maintain aseptic technique, a drainage bag with tubing to collect the urine if indwelling catheter is inserted, a sterile catheterization tray containing a sterile bowl to hold the normal saline. Then we need cotton swabs to clean the perineum, a sponge holding forceps to hold the swabs while cleaning the perineum, a catheterization catheter, plain rubber or Foley's catheter to withdraw the urine, a syringe and a needle to inflate the bulb of Foley's catheter, a kidney tray to collect the urine. Now we will see how we will prepare the patient before catheterization. First, we have to explain the procedure to the patient if he is conscious to gain his or her cooperation and confidence. Then we have to place the patient in a dorsal recumbent position towards the edge of the bed near the nurse. Then we have to arrange the articles at the bedside. Then we have to place the screen or the curtain and drape the patient to provide privacy. Now we will see the steps of the procedure. We have to explain the procedure to the patient in order to promote cooperation and decrease the anxiety. Then the nursing principle here, it comes the comfort and a feeling of well-being. The scientific principles, the psychology and attention is diverted, promote relaxation. Then we have to close the doors or draw curtains or screen in order to provide privacy and a feeling of well-being. Then we have to wash our hands with soap and water and put on a clean or a sterile gloves to prevent cross-contamination. Then place a water-absorbent pad or a Macintosh lined with paper or a towel under the patient's buttock in order to provide comfort and safety and to prevent bed linen spoiling. Bring the patient towards one side of the bed in order for a good workmanship and to prevent strain of the nurse arms and back. Then position the patient, if it is a male, in a supine position with thighs slightly abducted, while in a female patient, the patient should be in a supine position with the knees flexed. This will allow relaxation of the muscle and easy access to the urinary meters. Then we have to drape the patient with bath blanket covering both legs, leaving the genital exposed in order to provide comfort and prevent unnecessary embarrassment and exposure of the patient. Then we have to wash the perineal area with warm soapy swabs and plain water swabs in order to reduce the microorganism entering the urinary bladder. Then rinse and dry the area to prevent skin breakdown. Then we remove the gloves and wash our hands in order to prevent cross-infection. Now we have to put on a sterile gloves to provide sterile working environment and to prevent cross-infection. Then we open the sterile catheterization tray using sterile technique to prepare a sterile field and avoid microorganism contamination of the catheter. Then we have to clean the perineal area. In case of a female patient, we have to spread the labia with a thumb and index finger of one hand. Continue to hold throughout the procedure to prevent pathogens to be carried into the urinary tract from the genitals and to expose the meters. Then with the other hand, we use forceps to hold the cotton ball soaked in antiseptic lotion to prevent the infection. We have to clean the area from the clitoris down to the anus using one swabs at a time, because we have to clean the area from the least contamination first to the area of the most contamination. Here the clitoris is less contaminated compared to the anus. Then in the male, we have with a glove hand, we have to pick a cotton ball with forceps and clean the penis. Move it in a circular motion from urethral meters down to the base of the gland, and we have to repeat using one swab at a time to prevent the cross infection. Then a sterile catheter is kept covered until ready for use, because we cannot open the sterile catheter before we use it, lest it become contaminated with bacteria. Then pick up the catheter with a gloved hand 3 to 4 inches from the catheter tip. Hold one end of the catheter loosely in the palm of the same hand. Place the distal end in the urine tray receptacle if a straight catheterization is being done. This is to allow easier manipulation and insertion of the catheter for patient's comfort and safety. Then lubricate the tip of the catheter with a sterile lubricant to facilitate easy and safe insertion in order to provide comfort and safety to the patient, because friction between the catheter and the urethra may cause discomfort. Then gently insert the appropriate size of the catheter 2 to 4 inches for the female. For the male patient, lift the penis from the shaft just below the glands perpendicular to the client's body and apply a light traction upward. Retract the foreskin and introduce 7 to 9 inches. Do not use force to insert the catheter. Here we have to remember the size, like for the female is we have to introduce 2 to 4 inches of the catheter only, and for the male it is 7 to 9 inches. Then we have to collect the urine specimen if it is advised and needed by placing the catheter in the specimen container. For the indwelling catheter, we have to inflate the balloon with the required amount of normal saline. The required amount normal saline is about 10 ml or 10 cc to anchor the catheter in the bladder. Then we have to pull gently to feel the resistance in order to ensure that anchoring is proper. Then after it is properly anchored, secure the catheter. In a female, we have to secure the catheter tubing to the inner thigh with a strip of non-allergic tape. Allow for slack so that movement of the thigh does not cause tension on the catheter. Then in the male, we have to secure the catheter tubing on top of the thigh or lower abdomen with the penis directed towards the chest. Allow the slack so that movement does not cause tension on the catheter. Proper anchoring of the catheter is to reduce pressure on the urethra, thus reducing tissue injury in this area. This is done in order to provide comfort and safety to the patient. Now we have already secured the catheter and we finish with the procedure. Now we'll see with the aftercare of the patient and the article. After the procedure, we have to wash and dry the perineum to remove any urine spill on the skin. Then we remove the drape sheet and replace the wet linen. We position the patient in a correct body alignment and make him or her comfortable. We measure the urine and observe the characteristic of urine and we record it in the nurse's record sheet. Then wash the articles, dismantle and replace in the utility room. We send the urine specimen for laboratory investigation. Then record the procedure on the nurse's record. We have to record the time, the purpose, the amount and the characteristic of urine drain. Then we have to maintain the intake and the output chart. For the indwelling catheter, we have to ensure that complete closed urinary drainage system. Empty the collection bag at least every 8 hours in order to prevent infection. Keep tubing free of kinks. If we have to remove the Foley's catheter, we have to first completely deflate the balloon by drawing back the normal saline which we have already inflated. Then perineal exercise, we have to teach the patient in order to restore the sphincter control after a catheter is removed, because this is generally occurred when the patient is removed from a catheter. It tends to lose the tendency of control of the sphincter, urinary sphincter. Since I don't have the articles required for this procedure now, so I have attached one video from the YouTube so that you can link and watch it for better understanding. Thank you, ma'am, and thank you everyone.